Hi Sarah, how you doing today?
Good.
Doing well?
Okay.
Yeah?
Mhm.
A little better than last time? Worse?
Kind of no change.
No change?
Mhm.
So you're still having sadness?
Yeah.
Yeah. And frustrated?
Yeah.
Yeah. So tell me what's been going on this last week.
Well, Mary's been crying a lot, and I'm really tired. So I've needed extra help, with her because I'm so tired and I just can't get out of bed.
How much have you been sleeping each night, like on average?
I don't know, maybe 8, 10, maybe more.
Maybe more? Yeah. And how long did you sleep each night before you had Mary?
I don't know, maybe 6, 8 at the most.
Right, so your sleep habits have changed a bit.
Yeah.
Right? And you talked last time about feeling sad. What else has changed?
I'm kind of feeling, like I'm not doing good with Mary, that maybe I should think about getting a job again.
And when you say not doing good with Mary, what specifically is going on that's contributing to that thought?
I just remember with George, he would cry in the middle of the night and I would hop right up. And with Mary, when she cries, I just want to roll over.
So you're less enthusiastic about caring for her than you were as compared to George?
That's a good way of putting it.
Yeah. You still do care for her, though?
Yeah.
Yeah.
Mhm.
Anything else has changed?
I can't think of anything, but I'm sure there is.
Well, tell me more about the sadness. Where do you think that's coming from?
I'm not really sure. Maybe just because she's crying all the time and I don't feel like I did with George. Everyone said I did such a good job with him and I was a fantastic mother and I was doing such a great job and I just, people are saying it, but I just don't feel like I'm doing as good a job as I did with him.
All right. So people are giving the same input. They're saying that you're a great mother in regard to Mary, like you were with George, but you're feeling differently about it.
Yeah.
So their piece really hasn't changed. Like they're still giving you the same feedback. But your feelings definitely have changed.
Yeah.
To the point where you feel like you should just get a full-time job and I guess Mary go to daycare or?
Yeah, because she's, little. She's only 6 weeks now, so yeah, she would go to daycare.
So what comes to mind when you consider doing that, like working full-time?
Kind of mixed feelings. Like, I was home with George until he went to school, so I feel like Mary wouldn't be getting the same thing that George got, but I feel like she's not getting the same thing right now.
Like you're just not doing the same quality job.
Right.
Yeah. What kind of things did you do with George that you look forward to, like when he was that age?
I would sing to him a lot, and we would read books. I started reading to him when he was still in my belly, and then when he came out, everyone's like, oh, it's too soon, but we would read all the time. I would take him to the playground quite often.
Like most days? Or?
Pretty much, yeah.
And that was something you really look forward to?
Yeah.
Have you done those same things with Mary?
I try to, but maybe it's because she's a little fussier. I try singing to her, and with George it would be like 1 or 2 songs, maybe even just one song, and he'd calm down, and Mary's just not the same. It takes longer, or she just doesn't respond to singing or reading books like he did.
All right, so each infant or baby is going to be a little different.
Right.
Right. But that feedback's still important to you. You would prefer if her temperament was more in line with how George's was.
Yeah.
If it were, do you think that would make enough of a difference to kind of break you out of these feelings of sadness?
I would like to hope so.
Mm-hmm. So part of this could be just adapting to her personality?
Maybe.
Maybe. What else could be a part of it?
I don't know. I mean, you know, some of my girlfriends have kids the same age or babies the same age, and they're going back to work now, or they have been working for a while, and I kind of feel like now that they're working and have 2 kids, they kind of look down on me.
So they look upon you negatively because you don't work?
Yeah.
Now you say you get that feeling. Do you have evidence that we talked about cognitive behavioral therapy and evaluating evidence. Do you have evidence that that's the way they feel?
It's kind of just a feeling, and I forget exactly what she said, but one of my friends was like, oh, well, you have so much time to do all this, and I'm always working. And it just, the way she worded it kind of made it feel like, you know, I have so much to do, what are you doing?
Kind of minimized.
Yeah.
You know, your place.
Mm-hmm.
Yeah. Well, I can see how that would hurt, right? And there's always going to be people that say things that we'd prefer they not say, or feel a way that we perceive negatively as a negative effect. But this sadness, I mean, as we've been talking about it in weeks prior, is really markedly worse than what you've experienced ever before.
Yeah.
So, you know, after you had, how old is George now?
6.
6.
Mm-hmm.
So after you had George, there was really no period of sadness from what you reported.
No. It was just, not sadness, it was just having to get used to having a baby around, but...
Adjustment.
Yeah, he was my first, and I was so ecstatic to have him, and my husband and I were so happy. You know, he was our first baby. We were really happy with it, with him.
Mm-hmm. And you don't have that same feeling now.
It's not that I'm not happy to have Mary.
Mm-hmm.
It's just, I don't know, I feel like things are so different. You know, I have George to take care of. He's running around.
Mm-hmm.
I can't give him my full attention anymore. Mary's constantly crying, and I can't seem to soothe her, and I just get frustrated with her.
So there's adapting to her needs and personality, but also George's role has to change.
Yeah.
Because he has to fit into a family with a new member.
Mm-hmm.
So there's a lot going on in your mind and a lot of different feelings.
Mm-hmm.
But still, this sadness is, when you first came in, this was really what was on your mind, right? Is sleeping more than you wanted, not really experiencing enjoyment with Mary the way you'd hoped.
Right.
And then, I think, too, kind of a negativistic view of your situation that we talked about. Like, you're seeing things from a negative point of view, when before you reported you had not.
Right. You know, with George, he would start to fuss and cry, and I could get him calmed down fairly quickly. But with Mary, you know, she starts crying and fussing, and I feel like it may only take like 15 or 20 minutes, but to me it just feels so much longer, and I give up at a certain point, and I just hand her off to whoever's closest, and they seem to get her soothed right away.
Which may be all the more frustrating because you couldn't.
Exactly.
Mm-hmm. So have you been having any feelings of like guilt or anything like that?
Yeah. I mean, when I can't soothe her and I just hand her off, I feel like I'm not a good mom to her like I was with George.
So it comes back to like you just feel like you're not given the same quality care.
Right.
Yeah. All right. Well, there's a lot of thoughts going on, right? A lot of feelings going on, and I want to get to those and talk about those and work through them. But in the immediate, I want to look at some of the behaviors.
Okay.
Right? So, thoughts, obviously, what you're thinking. Behaviors, what you're doing, right? Like in terms of, like you mentioned, reading. With when you used to read with George, something you enjoyed. And sometimes when a person has kind of depressive feelings, it's important to engage in activities that would normally bring enjoyment, even if you don't get the enjoyment, right? Which at the time doesn't feel comfortable, right? It actually can be a little frustrating.
Right.
But the alternative is an avoidance, oftentimes is an avoidance of those activities, which can make things even worse.
Makes sense.
Does that make sense?
Mm-hmm.
So in this particular case, what's going on with your family having to adjust to a new member? What activities were you really looking forward to, like when you were pregnant? Like what things you're looking forward to doing at Mary that we could kind of schedule, like that we could kind of plan for you to do?
I would definitely say reading and singing to her, and just being able to hold her when she was calm.
Okay. So reading to her, singing to her. Anything else? Anything else that you were, like back when you were pregnant, you're thinking, oh, that would be really fun if I could do that with my child?
I guess just thinking back to what I used to do with George was taking him to the park, and I was really looking forward to that with Mary, but it just didn't happen.
It's not been happening, huh? Have you tried before to go to the park? Like have you started like packing or getting your car keys and getting things ready?
We went once so far with some of my girlfriends, and then it was okay. And then she got fussy towards the end, and the next time, I said I would go, and I just didn't.
So what happened at that moment when you said you were going to go and it was getting close to the time when you wanted to go? What happened then that led to you not going?
I just I guess I got sad thinking about what happened the last time. So it just frustrated me, and I didn't want to end up, unhappy.
So feelings of sadness and thoughts that you would be unhappy. Okay. So that's one of the obstacles that we'll have to look at with that particular behavior. So I like to plan these things out. Let's go with those three things that you have. Right?
Okay.
So you have the reading, right, and the singing, and I presume both of those you just do in your home.
Right.
And then the going to the playground,
to
the park. Okay. Which this time of year, I imagine you could go almost every day.
Yeah.
Right. Was that something you would have done?
Yes.
With George? Yeah, I did too. All right. So maybe we can schedule this. The reading. How many times a day did you do that with George? I want to say average.
Not many times a day, but it would be like consistently every day for like 20 minutes a day.
20 minutes a day.
Mm-hmm.
All right. So, within the scope of everything you're doing, caring for Mary, 20 minutes isn't a lot of time.
No.
Right? So do you want to set that as a goal? So maybe like during like Monday through Friday, because I know on the weekends you do other things, and 20 minutes a day, Monday through Friday, it'd be like reading time with her.
Okay.
What's a time of day that you think would be realistic to do that, based on everybody's schedule?
Probably, well, it's summertime now, but I would have said when George is in school, because he wouldn't be there bugging me. So right now, maybe like right after dinner time. for her.
So about what time would that be?
Like 6, 7.
Okay. So let's say 6:30.
Okay.
All right. So that'd be like kind of like the target time. All right. So around 6:30, Monday through Friday, 20 minutes of reading. That sound something you could kind of push yourself to do?
Yeah,
You believe it's something that would be good for Mary?
I do.
All right. So maybe that's the thought you carry into that when other thoughts come up.
Mhm.
And we'll talk more about the thoughts later, but when other thoughts come up that attempt to derail that, the thought could be, well, this is good for her. Even if it's a little frustrating for me, or I don't have the energy or the motivation,
Right.
it's good for her. So tell me about the singing.
With George, it was just like Twinkle Twinkle Little Star and
Mm-hmm.
the ABCs, and just,
Sure.
his favorite song was The Ants Go Marching One by One.
Okay.
So I get so frustrated I haven't found her favorite song yet, or maybe I did and maybe I missed it.
Mm-hmm.
But I guess just starting off with Twinkle Twinkle and ABC again would be good.
All right. Is there a particular time in the day when singing is convenient?
With Mary, I'd say maybe right before bedtime.
All right. So about what time is that for?
I try and get her in by like 7:30, 8 at the latest.
All right. So it wouldn't really be long after the reading.
Right.
So you'd read, you'd have a little break, and then as you get her ready for bed, singing. Same thing. Do you think that would be good for her?
Yes.
Yeah. So again, when those thoughts come up, your thought could be,
It's good for her.
This is good for her. And that's what you want, right?
Mhm.
All right. So we have the reading at roughly 6:30,
Mhm.
and then the singing, and out of a 7-day week, how many times would you like to sing to her?
I mean, eventually I'd like to get to every day again.
Okay. So you want to start maybe at a minimum of 4 times?
Okay.
So shoot for 4 times a week?
Mhm.
All right. And then, so that'll be the second step. So the first step's the reading, second step's the singing. And how about going to the playground, the park?
You mean like how many times?
Mm-hmm. How many times in a week?
I'd say maybe start with like 1 or 2 times right
Okay.
now.
Let's go with 1 time. Okay. So when I said that, you kind of sighed a little. So tell me what you were thinking right then.
With George, I used to go almost every single day.
Mm-hmm.
And it's so draining to even think about going with Mary right now because I'm so tired.
So with this one, you're going to have a lot of thoughts and a lot of feelings that might impede completing that goal.
Mm-hmm.
Right? Are there any other resources we can bring to bear to help you get out of the house once a week, like family supports or anything else?
Yeah, my mom and my mother-in-law live close, and I know they have like different days they have off during the week. So one of them, I could choose the day when one of them are off
And then maybe ask them
to help me. Yeah.
So is that type of external motivation, like when another person comes over and helps you get ready and maybe, I don't know, goes to the park with you or however that works, does that help you?
I would say so. Yeah.
Kind of keeps you moving?
Yeah.
You're saying you don't
Definitely.
feel?
I completely lost it.
It's okay. But the feelings are different.
Yeah.
When somebody's there to push you a little bit.
Yeah, I feel more like I have to show I'm as good a mom with Mary as I was with George.
Yeah.
So it makes me push a little bit harder.
And we'll talk about this again later too with the thoughts, but evaluating the evidence, you do seem to be as good a mom. Right? You're thinking that you're not. But if you look at the evidence kind of suggests you are.
Mm-hmm.
So there's a disconnect between the evidence and what you're thinking, which could partially explain the feelings of sadness. Does that make sense?
Yeah.
But we'll get to that. Let's. I want to make sure we get the behavioral part of this in place. So we have the reading 5 times a week, singing 4 times a week, right? And 1 day a week going to the park, the playground.
Mm-hmm.
And for that, you're going to get some extra help with the timing and the support. Try to stay motivated.
Right.
So well, first of all, does all that seem realistic? Like something you could do?
Yeah.
You have to fight through some feelings, right?
Yeah.
So I want to make sure I underscore an important point, which is perhaps some of the times when you try to do these things, you won't succeed. So try to accept those as isolated incidents that are independent of everything else you do.
Mm-hmm.
Right? So if you can't, for example, the reading's 5 days a week. So on a Wednesday you don't read, that doesn't necessarily predict what's going to happen Thursday.
Okay.
Does that make sense? Like that can be just a one time where you couldn't get to it. Right? The feelings, the thoughts, something else external happens and gets in the way. Right? Thursday's another day, and you try again.
Okay.
Because you don't want to fall in kind of the same trap where you stop doing it, right? And allow the times when you didn't do it to become something that's kind of used against you in your thoughts.
Right.
So you could miss one time and say, oh well, this proves that I'm not a good mother because I missed that one time.
Right.
When really all it proves is that you missed the one time.
Okay.
Does that kind of make sense?
Yeah.
So what I guess I'm asking is don't expand any unsuccessful attempt into your whole week.
Okay.
There'll almost certainly be times where life will get in the way, right? Things happen. So you have to give yourself that leeway and kind of forgive and just press forward the next day and try to do your best.
Okay.
All right. So those are all behaviors you think you can more or less stick with, right?
Mm-hmm.
At those levels. Let's start there for this week. And when I see you next week, we'll follow up and see how you did with that, and then we'll start talking about some of the thoughts and some different things you can do there.
Okay.
Does that sound like a good plan?
Yes.
All right. Thanks, Sarah.
Thank you.